Greeting, ladies and gentlemen. My name is Pauline, and I'm the Vice Chairperson for IBC. It is my pleasure to welcome you to the 5 Minutes Healthcare, an initiative from the IBC Health Working Group. I would like to introduce Dr. Reginald Liew from Parkway Hospitals Singapore as our guest today. Dr. Reginald Liew is a senior consultant cardiologist, and he will be answering a series of questions on heart health over the next few weeks. Now, Dr. Liew, can you please tell me what are the different ways to diagnose a heart disease?
Yes, there are lots of different tests that we can use as cardiologists. It really depends on the symptoms that patients have and their risk factor profile and what we're trying to look for. So classically, when we talk about general checkup for the heart, we start with an ECG, which is just a simple test where we put electrodes onto the chest wall and we look for abnormalities such as a heart rhythm problem or look for signs of heart attack or high blood pressure. We can get that from the ECG. That's very simple to do, and even as a screening test, it's quite common and easy to do. Then a more useful test is, say someone has chest discomfort, we often do some sort of treadmill test or stress test. So we get them to do a bit of exercise on a treadmill machine or a bicycle, and we monitor the ECG during exercise. And this can sometimes pick up abnormal heart changes on the ECG, which can be suggestive of blockages. If we are suspicious that there could be a severe blockage or narrowing, an even more accurate test is to do something called a CT coronary angiogram. So this is a specialized CT scanner where the patient goes through the machine and the doctor then injects a bit of special contrast, radio opaque contrast that will show up the blood vessels outside the heart. And this will tell us if there's any severe blockage or narrowing. It's quite safe to do. There's a bit of radiation involved, but it can really give very important and detailed information. So those are the common tests for coronary artery disease. Then for patients with suspected palpitations or arrhythmias, we often put on something called a Holter monitor, which is a heart monitor that patients wear on their chest wall for 24, 48, or even 72 hours. And this test allows us to monitor the heart rhythm continuously, day and night, to pick up any abnormal rhythms if it occurs during that time. And if we worry about people with breathlessness or a heart muscle disease, a very useful test is something called an echocardiogram. This is an ultrasound scan of the heart that actually will show us if there's any problems with the heart muscle or weakness, or if there's any problem with the heart valves. Some people get valve thickening or regurgitation, valve leakage. That can also be quite dangerous. So these are the common tests that we use to visualize and look at the heart in a non-invasive way. So can often be done as an outpatient and are quite safe to do. Then of course, if people have a strong risk of having severe blockage that may need treatments, that's when we do something more invasive called a coronary angiogram. That's often done in hospital in a cardiac catheter laboratory. And the patients are admitted usually as a day case, or sometimes they stay overnight. And the doctor can actually put little plastic catheters in the blood vessels of the arm or the legs up to the heart, and we can actually inject contrast and look at the blood vessels directly. It's the most accurate way to assess for coronary artery disease, and it allows the doctor to treat at the same time for any blockages with special balloon or stents to open up the narrowing. So a number of tests available, and it's the job of the doctor or the cardiologist to decide what's most appropriate and what information we're trying to get from the tests.
Wow, thank you, Dr. Liew. Thank you for explaining all these different ways to diagnose a heart disease.